Hey, it's Dr. Colby, Integrative Healthcare Solutions. Today we are going to talk about whiplash. Most whiplash occurs in motor vehicle collisions, and with whiplash there's a giant forward flexion and then also, boom, the extension back, and that is going to put a lot of sprain and strain on that neck. Whiplash takes generally 72 hours to set in, and most common people start to feel that stiffness, tightness, soreness. More advanced is going to be headaches, tinglingness, pain in the mid-back, shooting pains, sharp pains. And with whiplash, it can be a very serious condition, and it is very important that you get that treated. What happens is the ligaments in your spine are rough and tough ligaments, and due to that giant flexion and extension, that acceleration, deceleration, these ligaments and disc muscles all get injured. And so it's very important to get that treated. At our office, what we would do is an examination and figure out exactly what areas are injured from this whiplash and this force that you've had. And then from there, we would do x-rays. For the x-rays, I'll show you guys some normal x-rays and then what happens with whiplash and why it's so important to get treated. Normal x-ray here. This is a picture of someone from the side. They would be flipped opposite way. But looking at this x-ray, this is normal. We see that nice curve. The reason you have that curve is architectural strength. Same reason bridges have that curve is strength. So as you can see, all the disc and ligaments are intact, well maintained, and this is a normal x-ray. When we see whiplash, what happens is because of that giant flexion forward and extension, you can see in this picture, this is someone who has a lot of whiplash, a lot of sprain, a lot of strain of those ligaments. That spine is actually reverse, and we can see phase one here, that reverse curve, a lot more pressure on those joints. Before this accident, this person had a normal curve because of that giant whipping motion, the force and the jerking. Phase one right there. So then what we do is to test the sprain and strain, the severity of the whiplash, is we have them do motion studies. So we want to see the flexion and extension, and as you can see in extension, this patient has severe sprain of the ligaments, and in flexion is where we really see the laxity in those rough, tough ligaments. Should be a nice smooth, and as you can see, there's a lot of jumping, and what that shows us is when the ligaments get stretched out, there's now laxity of the vertebrae. So that is that sprain. Typical time for a sprain injury is 4 to 6 weeks to heal. Strain also 4 to 6 weeks to heal. And now I'll show you some common treatment for whiplash, sprain and strain. Once we have done an examination, we know exactly the problem. Whiplash, number one is start using ice. First 72 hours, very important, you start ice. You're gonna do 20 minutes on and then 40 minutes off. And continue that hourly as much as possible. Also, a cervical collar, how that works is you wrap it around, you put your chin under the indentation here, and that will keep your spine supported and support those muscles and ligaments and disc. And let me take this off here. And then also some therapies we offer is we offer electrical muscle stimulation, we offer ultrasound, and all this to help your body heal in that first 4 to 6 weeks is very important. Decrease inflammation and allow your body to start moving correctly. Also is orthopedic pillow is very beneficial. Reason being is it helps promote this curve that was injured. Typical treatment in the first phase of whiplash is going to be 3 times a week for 4 weeks. After 4 weeks, we do another re-examination. If needed, we may order MRIs to see if there's been further damage to the spine. And then in the next phase of care is when we start physical therapy, we start rehab exercise, corrective exercises, because we want to strengthen your spine. So a typical treatment plan is 2 times a week for 4 weeks. And after 2 times a week for 4 weeks, by then your spine's starting to feel good. You're starting to feel closer to back to normal from that injury, and then from then it's maintenance to keep that spine moving. Reason being, if you do not get proper treatment for phase one subluxation, whiplash, it's going to very quickly turn into arthritis. Reason being is you've lost that curve, you've lost that strength, the body's going to adapt and you're going to get arthritis in there to stabilize those joints that were injured. So this is Dr. Colby, Integrative Healthcare Solutions. If you have any friends with whiplash, or if you've experienced whiplash yourself, comment below and have a great day.